In Health Watch tonight, as we head into cold and flu season, the healthcare community is fearing a twin-demic.
In today's Health Watch, Local 5's Connie Feldman shows us that you don't need to be a scientist developing a vaccine to be the one who is the most effective in stopping COVID-19.
Hospitals are filling up. Healthcare workers are nearing exhaustion, and we are heading into the holidays. It's easy to get overwhelmed and feel helpless. But as we wait for a life-saving vaccine, a couple local doctors recently told me it's actually the community at large that has the most power to help us end this pandemic. Here's what you can do to help.
And we wear the mask in the correct way, which is covering the nose. We don't wear it here. We don't wear it here. We just wear it exactly the way we're supposed to.
Dr. Raul Mendoza demonstrates one simple thing we can all do to stop the spread of COVID-19. Mendoza and his colleague, Dr. Ronald Beno, are among the healthcare professionals fighting on the front lines to stop the spread of this pandemic.
Concerned that our staffs would be overtaxed if we have both a very large flu influx as well as COVID at the same time.
But even as the top talent in their field, these doctors say heading into the holiday season, they are not the ones who have the most power to stop this pandemic.
It is entirely on us, in you that you're watching and that you are planning to have a big family gathering. You may contribute to the delay of this pandemic.
As the nation shows an outpouring of support for medical workers with banners, applause, and other kind gestures, the workers themselves say one of the best ways you can help?
All ages 6 months and up should be receiving the flu vaccine.
It is extremely important for you to get the vaccine for something that we know that we can prevent.
The doctors say it is possible to get COVID-19 and the flu at the same time, and the combination is deadly.
They have about 6 times more chances of dying as compared to either infection alone.
And if you're still tempted to get together over the holidays with or without your flu shot, consider this story from a CDC report. Earlier this year, an Iowa college student tested negative for COVID-19, so she thought it was safe to go home to see her family in Wisconsin.
I went up north with their parents, and she had tested the previous day as negative, but she didn't know she was going to convert as positive the following day. And so she infected everyone.
Doctors say they want to make clear the flu vaccine will not make you sick. They say the reason so many people have that misconception is simply because the time of year people get their flu shots is the same time of year most people get sick with cough and cold symptoms. And that's your Health Watch. I'm Connie Feldman, Local 5 News.